Hi, everybody. This question comes from our monthly Ask Dr. David Live series. Hope you find it helpful. What treatments have you seen bring the most improvements for children on the autism spectrum? Okay. Now, of course, coming back to the individuality that there's no one size fits all, but there are a few things that I have seen to be big winners. Now, going back to the very, very beginning of this, the first thing that I saw, which I would still say of all of the treatments that I've done, the single treatment that's helped the most number of children over the last 25 years of me doing this is anti-fungal therapy, and in particular, the medication called fluconazole. One of the few times that I am quick to use a medication is anti-fungal therapy. As many people know, a lot of our patients have had lots of antibiotics. That can lead to killing off the good bacteria. Babies who were born via C-section, or if the mom took antibiotics during delivery, they could have low levels of intestinal flora. When there's low intestinal flora, then other things, what we call opportunistic infections, have the opportunity to grow. And these include things like candida and, to a lesser extent, clostridia bacteria as well. Going back to the beginning, that was the first mom of a child with autism said, "Hey, there's this test that you can do to check for yeast. Would you run it for my kid?" And we certainly learned about it. This was something that was commonly seen in neonatal ICUs in premature babies when babies get thrush, diaper rashes. It's yeast. So clearly, I had experience doing this, and the mom said, "Yeah, you just use the same antifungal medications," which of course I was very well versed in that from my time giving intravenous fluconazole to premature babies in the neonatal ICU, which I've always considered that's a pretty good way of knowing if something's safe to do. If you're comfortable injecting it into a premature sick baby, then you're probably okay with giving it to a healthy by oral child otherwise. But my goodness, the things that I've seen from taking antifungals. In fact, sometimes I'll have a parent will contact me and say, my kid's yeasty again. And there's no textbook definition, but they've seen their kids with yeast. They've seen their kids without. They know what they mean. I've learned to know what they mean. When parents first started to report this to me, I would say, okay, let's go ahead and get stool and urine tests to see if it's there. And then I learned relatively quickly that first year that the parents were right like 90% of the time. And then I said to myself, well, why am I spending several $100s and waiting weeks to get the results back for a treatment that I've already had success with and have given it to the patient and they did well? And so after about a year, I then transitioned over that if a parent told me that their kid was yeasty again and they did fine before it worked, I just put them back on the antifungal. But then, of course, I need to talk about, if it happens again, other things, dietary control, other things we can do to try to keep yeast from coming back. But that was really the first big bang that I saw. Casein and gluten-free diets. For those who don't know, in some children on the spectrum, they seem to not be digesting the casein and gluten proteins fully. They partially digest it, and they can form these opium-like substances that can cause brain fog, GI issues, behavioral aloofness, all of that. So that can be an incredibly helpful thing. I would say the next big thing that I saw was methylated B12. I mentioned, there are now, this is something that we historically have given by injection. The reason why is if you swallow methyl B12, it becomes demethylated in the gut and doesn't get into the bloodstream that way, especially if a person genetically can't reactivate it to methyl B12. We do use other ways such as nasal sprays, sublinguals, as ways of getting it into the body besides injecting it. But still, I've seen some rather amazing things in the injected form of that. And then more recently, I certainly will put a plug up for medical cannabis. It's the CBDs, combining them with the CBG for anxiety, combining it with CBN for sleep, and THC. Now, of course, we're always cautious about THC. We're concerned about giving developing brains THC. And of course, the kids that we are giving this to have developmental and problems where there's potentially serious violence and aggressiveness and irritability, just making it so tough to live with. And so we are improving quality of life. But my goodness, have I seen literally households kept together because the edge was taken off. I've seen kids not have to be institutionalized as teenagers when the hormones kick in because of medical cannabis and THC. So I would certainly say that, it's certainly up in my top few now. It's not getting to a root cause issue, but my goodness, you can see an improvement the first time out that you give it to somebody, and that's truly a blessing for a family who is so in need of support.